physical therapy. I've been doing workshops with Cali for like 3 years now. And then I found another physical therapist to marry. Now 2 of us. And yeah, we're really passionate about helping people. What stops you from coming to your workouts? Nagging injuries, right? We get something, it keeps nagging us, keeps bothering us, it slows us down, it pulls us back from our workout. If we make progress, we have to pull back, we lose progress, right? We want to give you guys as many tools as possible so that you can have those maybe nagging injuries come up, but know what to do when they do. Have the tools in place when those things do happen. So we own a physical therapy practice right now, about a mile from here. Our focus with that is that so we don't want you to rely on us for the rest of your life. Our goal is to have you graduate. A little different. We work one-on-one with our patients for an hour, making sure that you have that undivided hands-on attention. And then also we work out here with you guys, usually just Monday mornings. But so I'm Dr. Jen. This is Dr. Owen, and we're getting married in 3 weeks from today. So that has nothing to do with the workshop, but it's just a fun fact. No, we're getting married like Santa Barbara area. But okay, I'm going to let Owen take over and go into what we're going to be learning today, because we have a lot of good stuff for you guys, and it's going to be fun. Do you have time to ask them what they got going on? Oh, yeah. Can you go around real quick? Just say your name real quick and say what you're interested or what you got going on, like hip, back, shoulder. So. Or good, I want to learn, whatever. Back, shoulder. Jason. Gotcha. Oh, Jackie, my elbow. Gotcha. Remind me of your name. Megan. Cool. Yeah. Last week's and this week's going to be awesome for you. Yeah. Last time. Oh. So that takes like all this area. Yeah. What's your name? Angelica. Angelica. Nice to meet you. How long have you had that diagnosis? Like a year. And are they looking at surgery or are they training? Yeah. Probably going to replace that hip. Oh, you guys are like injured like Sciatica sisters. That was way better than what I thought. Serena, I just generally lower back pain. Okay. All of it? Oh. Chapter 1. Lower back, hips, and knees. Okay, but you show up. Awesome, awesome. Okay, cool. Yeah, so today we're going to be going over, we call it freedom from back pain, because at Advanced Physical Therapy and Wellness, we're all about freedom. And being free from injury allows you to be free with your workouts and allows you to be free to be your best self with your family, friends, and community. So that's what we like doing. And we like giving people the tools to be able to help themselves. Like if you're like, I worked in these stretches for a while and I got better, it's like, great, cool. Then you're able to do the proper movement patterns and then pain goes away. Awesome. If you have to come see us, there's always an option for that. If you need manual therapy to really get in there and move stuff around, more than happy to help you guys out. So today we're going to be going over, it's kind of a build off of last workshop, last month, the freedom from hip pain. But unfortunately, we couldn't really go over everything so in depth that there's a lot of things. We only got 1 hour. So it's like, well, we're going to kind of break it up. So we're going to do a lot of the hip stuff the first day. Today, we're going to be covering some hip stuff too as well, but everything translate up into the back. Like if you're limited in a certain range, like internal rotation of the hip, like I am, and I wanted to be a golfer and I'm going to swing like this every single time, boom, and I don't have that range, it's going to translate straight up to the back and then my back pain. That's the reason why Tiger Woods has had, what, like 5 back surgeries? So that's what the... Yes. So as you guys know, I always suffer like lower back pain. It seems like over 20 years, it's a chronic pain. And I've seen so many people come in before and nothing really helped. I literally wake up every morning and I feel like I was like long, my neck was locked. I think like at least 30 minutes of my day to start working out and get into a normal walking around. And I've been seeing Dr. Owen for the past month. And honestly, a month or 2, right? Yeah. And honestly,
where the days I'm tight. So yeah, I just want to say thank you.
Yeah. My pleasure. My pleasure. Yeah. Thanks. And it's always good having Coach Tato in, you know, and things keep coming up, you know, more so recently. And so yeah. Low back's good. So it's good. We just got to work on some other things. But I love it. I always love having him coming out because we have such good conversations, and keeps me on my toes and keeps me good in practicing. Not only in like physical therapy, but in life. Like he's the man. Like if you guys want to learn some things, read some of the books that he has and he reads. So anyways, today we're going to be continuing off the kind of the freedom from hip pain, freedom from back pain. If you do everything all in combination, your hips are going to be doing a lot better. Your back's going to be doing a lot better. Even I'd be willing to bet your knees are going to be doing a lot better. Maybe not ankles, but they could be too as well. But similar to last week, we're going to be covering a couple of tests and measures on muscle length. So you're going to find out where you're inflexible. And then therefore, when you know where you're not flexible compared to the norms or what you need to do like basic squats, deadlifts, all that stuff, then you're going to know today what you need to stretch. And then if you know what you need to stretch, then you can stretch it out and then you can work in those ranges. And then you should be doing a lot better with some of the movements that you're having problems with in the past. So that's a good thing about scanning the QR code. You get both last times and this times. So it's got two separate links and you click them. They got links to the Google Drive and you can check out the other one and this one. So to start things off, the first test that we're going to be doing is called the straight leg raise, or there's also another test that's similar, 90-90. And basically both tests teach you if your hamstrings are tight. So kind of like Tato was talking about earlier, we're going to be going over hamstrings, but also too, a lot of other things, some other hip stuff after this. So first, we'll be going over the straight leg raise. Basically, you just have someone laying in supine, it's called, or just on their back. And you're just going to move their leg up until you feel some tension back through here. Basically, you'll feel the tension and then you'll stop. Or you'll see their hip rotate backwards and that's where you'll stop. But with Jen, since she's a yoga teacher and she can do full splits, see how nothing's going on, nothing's going on, nothing's going on, nothing's going on. See, there we go. See that movement of the leg? Right there. It's like, okay. That's where you would normally stop with somebody. Now, a straight leg raise, that's even flexible. Normal is about there. So 70 degrees about is a normal finding for hamstring length. Now, if you're extra flexible like Jen, boom, you got like 140. The next one too, similarly, is the 90-90. So you just get the hip in 90 degrees, knee in 90 degrees, and then you start straightening out the leg. And then pretty much the same thing, you wait till you feel tightness or you see the other leg move. But as Jen already has 90 degrees, as we already went over, that's not gonna happen. You'd have to bring her up to here first and then start straightening it out. And then you start seeing some movement of that leg sort of thing and feeling the tightness. So, okay, yeah. So for 90-90, normal, similarly, 70 degrees from that 90, boom. So about 70 degrees from that 90, or technically it'd be 30 degrees from up in here. So that would be normal. This is flexible. So how you're gonna work on that, you can test both sides with one of your partners. You can see what's tight. And, well, because you can go straight into the treatment with the test. So if you're like, boom, tight, boom, tight. My favorite way to treat this in the clinic is to do Pnf stretching, which is a long-term proprioceptive neuromuscular facilitation. But basically, it just gives you the most bang for your buck. So they just call it Pnf stretching. So basically what I do with the patients is if they're tight in through there, I'll bring them up to the point where they're tight. I'll feel that first stop, and then I'll tell them to kind of dig their heel down, not very hard, about 10, 20%. One time I had this parkour kid that practically folded me in half. He's like, ugh. I'm like, no, 10%. Okay, so just a little bit, 10%, and then you have them relax. And after they relax, they get a little bit more flexible, so you can go just a little bit more into that range. And then you say, go again. And just for a few seconds and relax. Good. Just like that, for that, if they're basically, a lot of times they're gonna be tight, more tight one way or the other, but I usually just do both. So after that first round, then I come up to the other one, feel the first stop that she doesn't have, and say push whole leg, 20%, not too hard. And then relax. And then you pick up the slack till you feel the next stop, push again, and relax.
You want to
do it
2 to 3 times?
Yeah, 2 to 3 times. Now, if you don't have someone to stretch you, You can always use a band, which the ebook teaches you how to do it on your own. And basically you bring it up to that first stop where she's gonna feel it all the way up through here. She's gonna feel the first stop, and then she's gonna push that direction, kind of into the band, whole leg, about 20%, and then bring it back, pull in the slack. And then go one more time. And relax. Good, perfect. All right, so everybody, partner up. We're gonna be walking around. We'll work on it with you guys, coach you through it. So this is gonna be awesome for you.
So the partner up, I think we're gonna be one person, so I'll partner with somebody. Do you think
There we go. Yeah, looks pretty good.
Oh no, I can do more. I just don't.
Yeah, we'll do the Pnf stretch. So go ahead and push into it and then relax and pull it back up. And you'll see it. You'll get a little bit more range.
Are we doing the 90 first?
Yeah, go ahead and do the, either one. Doesn't matter, but you can do the 90 first if you want. Just bend the knee up. There you go. You're going straight leg raise. There you go.
Do I bend it like this?
Yeah, so keep it, go ahead and bring it all the way down real quick, just to see. And then, yeah, you just go ahead and keep the leg straight. Go ahead and go again. Keep the leg just straight, knee locked, and then just bring it all the way up so you feel that first bit of tension, or you see the other leg start to move. So probably.
Hamstring comes up and attaches there. So if our hamstrings are super tight, they're pulling our pelvis. They also attack other places and they can cause issues on the sacrum, or the whole pelvis. But that pulls the pelvis in different directions. And if we have the hip flexors tight in one direction or the hamstrings tight in the other, or we have both of them tight, it's kind of doing this tug of war on the pelvis, right?
And then that creates compression through the back.
And through the hip. So it's like, it's all, we have to have that mobility, because right, if my hamstrings are really flexible, my hip flexors are tight, my pelvis is going to sit like this. If my hamstrings are really tight and my hip flexors are more open, but even kind of tight there, like I could sit like this. We want to be able to find that neutral position and maintain that. And sometimes that can be really, really hard, right?
So
if you generally your butt sticks out, then what's going on? Which type?
Most likely your abs are not stable and your hip flexors are tight.
yeah, so like this.
There's a lot of.
Yeah. So basically, it could be anything. It could be tight hamstrings, kind of pulling. Actually, yeah, it'd be tight hip flexors, and lack of core stabilization. So yeah, most likely if they're sticking out like that, increase boom, just like that. And then if you got that and tight hamstrings, it's going to be pulling on everything, and it's going to make people almost want to stand like this. So if you see people, yeah, if you see like the frail people that have been sedentary for a long time, they're kind of in this position and they got to walk like this. But the good thing is a lot of you guys, except for Jay over here, have really good hamstrings, and that is probably, and you are working on it, and that's probably has something to do with your guys' warm up in Cali for fit. You guys all bend over, touch the toes in the warm up. You guys come to the sides, and then the cool down, you guys do the exact same thing. So you guys are getting hamstring stretches every single day. But we noticed last time, and a lot of the people that I see in the clinic, a lot of you guys have really tight quads and hip flexors. But so good thing we're already good on that. The next ones we'll find more positives, because I mean, even me, like I do lots of yoga. I know you do lots of yoga too. I have really tight internal rotation of the hip, which I'll show you here in a minute. But basically, I took this course on like the barbell athlete, and people that do Olympic lifts, they need a lot of internal rotation of the hip. If you come down into the squats with the snatches, even people that just do regular air squats, and when you're coming down to that deep squat sort of thing, notice how when I come down, my legs want to go out sort of a thing, because I have that lack of that internal rotation of my hips coming down. So they just, they want to go out. So one test is, but if you have such limited amount that I have, you can't even do it. I mean, it's like you want to remain standing up, and then you want to be able to kind of touch your nose, exactly like that. So we'll just show you, real quick what normal is. So normal is about 35 degrees of internal rotation at the hip. So coming in through here, boom. So if you check it out, Jen's got almost 50. If you check me out.
He doesn't. Jay, you have a friend on this one. Okay, so he has like, actually, no. You have like 22.
Ooh, that's better than usual.
Yeah.
I opened them up this morning. Usually it's like 15. But normal's 35, but the barbell athlete or somebody that goes down to deep squats needs at least 45. Otherwise, you're going to compensate by leaning forward, and it's going to start giving you back pain if you're unable to do that. So a hip internal rotation test, what we'll do, since it's a little bit easier, even on somebody like me that doesn't have a lot of it, is we're going to have you get into kind of a hurdler's pose. So not quite jumping over the hurdle, but just basically kind of 90 degrees front, 90 degrees back. And if you have normal internal rotation, we're going to be looking at the back leg. If you have normal internal rotation, you're going to be able to get up into a straight posture. No problem. Me, I'm leaning to the side because I don't have it.
Yeah, and even me, like it's like, oh, hold on, if I come this way, yeah. So if you look out to the side, your legs should be like right out to the side. Yeah, that's perfect.
Yep, Jason's got some good internal rotation.
Yeah.
There you go, there you go.
So yeah, and I'm even me sitting here, like I'm a little cockeyed, right? But like I can hold myself up and straighten myself up. Like Owen can't, like he's like over to the side.
Yeah, I'm like the leaning tower of Pisa over here.
I feel
Yep. Jay's got it too.
Ladies, looking good back there. Yeah, you got tons of mobility. How does it feel for you? It looks pretty good. Little off, yeah. And we can measure people's hips if you're not sure too. So then switch sides.
Then you have to go all the way down.
So Chris, come to the side and get more in front of you. Yeah.
Actually, I got more on this side. I feel a lot better over here. This is my short leg though, so.
How do you guys feel? Do you feel like one side tighter than the other?
Yeah. So on the tighter side, so see if you can, we'll have you kind of bring this foot out through here. There you go, right in through there. And we'll kind of bring this one up through here. There you go. Okay, and then try and kind of sit up straight if you can. Feel that?
Yes.
Feel it in the back one? Yeah, so that's. And then try the other side now. See if it's any different. Yeah, there you go. Yep, looks pretty good. A little better? Cool. Then go and switch sides so you can stretch the other side. All right. Wow. You teach him how to stretch it? Yep. Basically. Whoop. Okay, so for the pinching, basically what you can do is to kind of get the pinching away, you can put your hand down where that pinching location is, push down, raise your spine up, and then kind of lean into it. I'll show you real quick over here. So you're kind of pushing down, boom, raise your body up, and then try and lean into it. And if it's still not helping out, could be undergoing something called femoral acetabular impingement, particularly if you have problems doing this motion sort of thing or that motion, you still get that pinching. So one thing you can do, other than see me to get rid of that, you can stretch your internal rotation of your hip by doing this.
Let's all
so
actually try that.
Coming in this direction.
So lay on your back and your feet a little like as wide as the mat you're on.
Mm-hmm. Then you go figure four. So try it on the one you're getting the pinching.
So take one leg in and cross the other leg over that knee and drop it in. Yeah.
Yep. And then just start rolling it.
Try to keep your butt on the floor.
Yeah. Try and keep your butt on the floor if you can. And that's when you'll really start to feel it.
Yeah.
No.
You might feel a stretch on the outside of the thigh too. But you'll definitely feel it. So come back down.
There you go. You feeling it? So other way. Yeah, there you go. So you feel it. Try and keep your butt in contact with the mat if you can. There you go. Feel it? Yeah, there you go. Yeah, if you got a bunch, we'll see the next one on you. You might be a little bit off on the external rotation. We'll see. We'll see.
Feel a little stretch. And you're pretty open, so you might not.
Yep, you're nice and open.
Try it on the other side too. If you feel it, Jay's like, I feel it for everyone. Don't worry.
Yeah, you're like me, Jay. Yeah, we're hip internal rotation partners.
Okay.
You just got to go to a yoga class with Jason. He will show you the way, Jay.
Do you guys feel it? Okay, switch sides. Okay, so you sort of. Okay.
There you go. There you go.
Not into the stretch.
There you go. There you go.
That's the stretch.
Do you feel it? Feeling it? You can kind of feel it lifting. So just we'll let it raise up, boom, kind of like that, or just kind of keep it pressed down, and then you go, and then you feel it. Feeling it right there? Yeah, yeah. But you're pretty good. You got some pretty good internal rotation. You can, yeah. You can either feel it there, or people that are going to be more tightness in the hips are going to feel it kind of like almost in the groin kind of back area. But since you have really good internal rotation of your hips, you start distracting your lower back, so you're feeling in your quadratus lumborum, your QL. Yeah.
But people that are tight in their hips aren't.
They're not going to get there. They're going to be like me, and they're going to feel it kind of in here, a little bit in through here. Yeah, where do you feel it, Jay? Yeah, yeah.
Oh man, good. Okay, so far we've covered today hamstrings and our internal rotation, right? These are huge components to. So there's a lot of research out there that shows that limited hip mobility is one of the largest contributors to low back pain. I would say that and our transverse abdominis, the inability to fire that muscle, which probably should be our next one.
The T-Rex muscle. Do you guys want to review the T-Rex muscle next time?
It's been a long time.
Okay.
So anyway.
And I don't think you had an ebook last time, right? I'll make the ebook.
Okay, so we're gonna look at external rotation now, which is just the opposite movement in the hip, and see where we are with things.
Yeah, so external rotation, normal is a little bit more than internal rotation. Normal is instead of 35 degrees of internal rotation, external rotation, normal is 45 degrees, so not too much more. If you're like me, you got a lot of it. And that's typically having to do with, like being a guy and the way you sit as a guy, you sit like this. A lot of times females will have a lot more internal rotation is because, because you sit with their legs adducted and internally rotated. So that's going to be constantly giving you a stretch, internal rotation here, internal rotation here. Now, if you're sitting like you see a lot of males do, you sit like this, and then that opens up their external rotation. So I have about double normal. I have almost 90. Let's see what Jen's got. Come on over here. So she's got quite a bit too.
I'm just pretty flexible.
Yep, 65.
So for this test, I know he beat me.
Yeah, I know, I won
For
finally.
Test, we'll actually grab some of
Oh, yeah.
these to sit on.
Yeah, so for the test, well, no, you don't necessarily have to sit on it. You just lay on your back. You just lay on your back, and then you're just going to bring your one foot over the other one, do kind of a figure 4. Normal will be about right here. And then if you got a lot, go right here. And then see if you can break off into partners, and you can kind of push down a little bit. Normal should not be a painful response either. So if you have an end range, you kind of do a little pressure in through there, and you feel it like in your back or your kind of lights up your sciatica symptoms. That could be some SI joint dysfunction. So check it out. So Jay is all good. I'm gonna come around, we'll kind of push on you. Jason, good. Yeah, see, Jay's good over here. I told you, hey, man. You kind of come in through here. Coming through here, all good.
Yeah, I mean, Chris, you're a little tight, but you're.
Let's check you out. So you do got good external rotation. How's that feel? Is that painful or? Okay. Is that your sciatic side? That is? Okay, we'll try that one in a minute. And I think you're the left side sciatica, right? Okay, we'll check it out. You're pretty good. Just check you out. Boom. And is this the hip or is this the hip? Okay, is that a little painful? Okay, that makes sense, that makes sense. We're gonna leave you alone. Okay, just gonna kind of push in through here. Doing okay through there? Painful or
Not painful,
just a
but I can
stretch?
feel it.
Okay, gotcha. I'm gonna push in right in through here. How is that?
Yeah, I feel.
Okay, just a stretch.
So
So
this
you
one,
guys can-
unfortunately, right where that muscle comes in,
Uh-huh.
there, that's the intention.
Okay.
Steal this. Yeah.
Okay, so we're gonna talk a little bit just about the hip flexors again, because we can't review it enough times. Like almost everyone's gonna have some tightness in their hip flexors, right? And this is something we all could benefit because we all drive our cars, sit at desks, like we sit a lot in our society. So your hip flexor comes from the front of your lumbar spine down to your legs, or from your inside of your pelvis down to your femur, right? So it's inside here and it's deep. So it's what flexes your hip. It's what helps you walk. It gets tight when we sit. So let's review some of the ways that we stretch the hip flexor just so that we can make sure that we're all doing it. Who's been doing their hip flexor stretches? I know he has. Okay, so not a lot of us have. Okay, so that's okay. So let's all come into a kneeling position. Put your left leg in front, your right leg in back. This way I can just go over it real quick. Okay, so take your hands to your hips and just tuck and untuck your pelvis. So belly button up and in. So not pushing your hips forward and back. Think about actually moving your pelvis. So you're trying to make the space between the front of your hips and your ribs a little smaller and then a little bigger. Find where it gets small and you feel a stretch, and then begin to shift just a little bit forward. Do you guys feel a stretch in the front of the right thigh? Yeah. Beautiful. Okay, from here you can take your right arm up and you can reach over just a little bit, intensify that stretch. Do this every day. You could do this here, or you can do this in more of like a high position if you're like, I can't kneel at the office, but I want to stretch, right? So
grab onto a wall or something too, so that you're not losing your balance, or a chair.
So switch sides. Let's just review that on this side real quick, just so we have it. So tuck and untuck the pelvis. Find that good tuck and that good stretch position. Lean forward into it. Reach up and then over if you want. You don't have to do that. It's just if you already feel good there and you want to go further, then you can always come into that like full position, right? So that's a super simple way to stretch your hip flexors that we should all be doing every single day. I just wanted to take a few moments to review that. Do you guys have questions? What questions do you have on that hip flexor stretch? No, it's like 30-second hold. You could do like 1 30-second hold 3 times a day. You could do, 2 or 3 in the morning. You can kind of figure out what works for you.
Yeah, personally, what I do every single morning is I do 6 stretches every morning. It's about 5 minutes. About the amount of time. So I start in with the hip flexor stretch, boom, do that, and then I come down kind of more into a hip mobilization stretch coming down through. You guys want to all do it, I guess? You guys can if you want to.
Make sure that your knee is not going past your ankle.
Yep. And then
Jackie, move your foot forward.
In yoga.
Yep.
So then I hold it there, and I just hold it for 5 deep breaths each stretch. So 1 breath, 2 breaths, 3 to 5 deep breaths, about 30 seconds. And then I come back.
Oh yeah, good call.
And then I go into
move that foot forward. Yeah.
Then I come back, go into a half splits. Raise your body up. Don't let your hips be cockeyed, and all you gotta do is just lean till you feel it.
You won't go far.
You won't go too far. So you feel the hamstring. 3 to 5 deep breaths. And then after that, then I'll bring it in, work on that external rotation. So getting into that pigeon.
So pigeon was too much for you. You can always go into the one on your back, guys.
Too much, you can always go to the one on your back.
Because pigeon can be a lot. You guys look good.
Boom. And then I do 3 to 5 deep breaths of that. And Jay's like, nope, not gonna happen. So you guys do the one laying on your back too. You guys do the one laying on your back. Try to set this up. Yeah, there you go. Do the one on the back, Jay.
Okay, much easier.
Oh, you got it real quick. Can your pigeon pose? Just come in through here. Boom.
Oh, that's right.
Just like Jay's doing. And then personally, might not be able to do this either, but personally, I want to get the quads too afterwards.
Okay, so if you can't,
starting in the right position, I'm going through there.
and if you can't get that in pigeon, you can do that in that kneeling. You could just reach back for the foot.
Yeah, you always do kneeling too.
Would it be helpful if we recorded just his routine so you could follow it in the morning and then you guys just be like, let me hang with Owen for 5 minutes? Okay, we'll do that.
Yeah, we'll do that. It's actually, I have pictures of it and I gave it to Tato, and Tato's been doing it every day.
Yeah, we'll do.
And then the last one is YouTube Pnf Stretch coming over here.
I'm gonna make it a YouTube channel.
Remember the last one? Or you can always do one sitting down, coming up through here, grabbing the foot, hugging the knee to your chest. Make sure the ankle's pulled and kind of inverted.
Cool.
And then I finish it off with a nice supine twist. So you can do it like this, or you can just have a bent knee and just kind of reaching out one side across. A lot of times I'll get like click, slow, and I'll do both sides of that. And that's my morning routine for my kind of open up my hips and my back, so that I don't have that pain throughout the day.
We'll get it so that you guys can literally just hit play and follow.
Yeah.
And we'll get that out to you guys because I think that'll be good. Cool. What questions do you guys have?
So sitting at a computer, like how often do you recommend getting up?
Once an hour.
Once an hour.
Yeah. Even if it's just getting up and like
Just moving.
Moving.
Really go through, like, you don't have to go through that stretching protocol.
but standing straight up.
I would say, yeah, but you'd want to stand up and move. Stand up and move. You got to stand desk.
And things you already love.
Kind of just bend forward, kind of stretch out the calves a little bit, and then move back to work.
Yeah.
Or you just go for a walk, but like you do a lot
March
of
in
sitting
place,
at work.
whatever you need to do, just get up and get the blood flowing.
Yeah.
Once an hour.
But I recommend like doing it every morning, just like a routine like that. Because then an open jump and get you ready. You're sitting at the desk. What's going to get tight sitting at a desk all day and not stretching out? Hip flexors, boom, they're going to tighten up on you. Hamstrings, since the knee's bent, since you know that 90-90 test, since the knee's bent, those are going to tighten up. So those tighten up, these will tighten up, everything will tighten up on you. So it'd be good just to stretch them out in the morning. You'll be open every single morning. And then if you want to just kind of get up and do a couple stretches throughout the day, awesome. If you want to do a nightly routine too, you're welcome to, but definitely just get up and move. But if you do, yeah. But if you do a lot of sitting, good to just at least stretch in the morning as often as you brush your teeth, probably. It's 5 minutes, just like brushing your teeth.
That's why people are like, oh, if I drink too much water, I have to pee a lot. I'm like, good. I like it. So drink your water, stay hydrated. Okay, so we're gonna wrap on up here. We won't be doing a workshop in March. We have too much going on today.
Wedding.
But we'll be back in April, and I think we can discuss potentially maybe going back into that core stabilization time. Because if we have all this flexibility now, if we pull it, some of you guys have heard from us before some of the deals we have for the Cali for Fit people, but I'll let Owen tell you.
Yeah, usually so initial evaluation and treatment, just coming in. Usually what we do is I do a evaluation where I take measurements. I use all these tools and whatnot. Like with Jason over here, I just something real quick. I'm like, that's part of it. But I'll take a good half an hour learning the history, what's going on, and then also take measurements. And then we'll do at least 3 manual therapy treatments to either get that pain and just eliminate it, or at least get a reaction where it's like, oh, wow, I had pain in this range. And then we worked on it for about 15, 20 minutes, half an hour. And then boom, range is all the way through there. Still feeling a little bit of pain there, but hey, that's better than feeling it right in through here. And then standing up, oh yeah, no problem, that's cool. And then it's like, all right, cool. Well, you're gonna be really easy. I'll see you just a couple more visits and we're done. Just so you can make sure we can get you back to just pain-free everything. Now, if it's like, we eliminate the first visit, like sweet, you know, we may just need to check in like one more time, make sure that we have a good, you also give a home exercise program with 2 to 3 specific exercises. We'll take a little video of you and stuff like that. And you can work on it at home. So you could just be like, you could be working on your home exercise program and we eliminated the pain the first day and you're like, yeah, I'm good. I did my home exercise program. I went back to Cali for Fit. I did all my workouts. I'm feeling great. And I'm like, sweet. Now that's perfect. Sometimes it takes a little bit longer. It just depends on what you got going on. And it could be like, well, you got, you know, not only do you have tight hamstrings, you got tight hip flexors, you got decreased segmental motion in your low back, you got SI joint dysfunction. It's like, it may take a few more weeks. It just depends. So, so the point is, initial evaluation is usually $200, but since we love Cali for Fit and doing these workshops. We got a special today for $149. So if anyone wants initial evaluation treatment, get the home exercise prescription, the manual therapy, and hopefully eliminate, if not improve, your pain, so where you can actually have some light at the end of the tunnel, knowing that we can get rid of it and you can get back to your workouts, and you're not just getting old. You know, you shouldn't just not go to Cali for fit. You know, we got to figure out why those things are, because we want to be able to give you longevity so that you can continue staying fit, staying in shape, staying away from imaging, surgery, pain medications for life, and not have to modify.